So hello, my name is Steve Parliament, and I am an adjunct faculty in the Department of Teacher Education here at the University of Wisconsin at River Falls, and was project manager for this group. And we're responding to a request for proposals from the Tommy G. Thompson Center on Public Leadership. The announced topic from the Thompson Center is preparing for public emergencies. Innovative institutional responses from schools based on their experience, assessment, and recommendations for a continuing response to the pandemic. Today, we are reporting the results of the research that we did that was funded by the Thompson Center. And I am joined in this report by two colleagues, Emeritus Professor David Trechter, who is the director of the Survey Research Center here on campus, and a faculty member in agricultural economics, and by Professor Molly Garish, a senior faculty sponsor of the project and co-chair of the Department of Teacher Education and a program coordinator for early childhood certification here at the university. I'd like to start by asking Molly if you would just introduce yourself and take it from there. Molly.
Hi there, Dr. Molly Garish. On behalf of the University of Wisconsin at River Falls, I wanted to thank the Thompson Center for funding this important research, the goal of which was to try to understand what worked, what didn't work when Wisconsin's primary and secondary schools were forced by the COVID-19 pandemic to switch from traditional in-person instruction to fully remote instruction starting in March of 2020. Professor Trechter is our guiding methodologist. David, could you describe our approach to designing the questionnaire, setting up hypotheses, structuring the survey methods, identifying our various populations, and drawing the interview samples, please?
Sure. The research group, including Steve and yourself and others in the Department of Education and Professional Studies of the College of, developed surveys for parents, for administrators, and for teachers at the elementary, middle school, and high school levels. The teachers' surveys were pretty much identical, but the results were segregated by those grade levels. We used a mixed method data collection process. We mailed paper surveys to about 3,000 households in Wisconsin that we believed had elementary, middle school, or high school age children. We had an open link that the Wisconsin Education Association displayed in their weekly or bi-weekly electronic newsletter that teachers could click on to go and take the survey. We worked with the Wisconsin Association of School Administrators to similarly include a link to the administrators survey in their newsletter. And we sent links to the 100+ private and independent schools that we had a list for, asking them to forward it to their administrators, teachers, and parents. So we used a multitude of methods to gather the data. I will say that one of the disappointing results of this effort was that the response rates were not great. So I view the results as indicative and not necessarily totally prescriptive. So we only received 289 responses from teachers. We received just short of 500 responses from parents and only 66 administrators. So most of the analysis that we did focused on the results from teachers and administrators. We hypothesized that certain groups would have more difficulties than others. Younger children, those in elementary school, might have more challenges than those in middle school and high school, both because of shorter attention spans and less familiarity with technology. We expected rural areas to perhaps have more challenges than suburban or urban areas because of relatively poor broadband internet connectivity in rural parts of Wisconsin. We wanted to see if there was any difference between the experience of private school teachers versus public school teachers. We wanted to know if teachers and parents of special needs children had a particularly difficult time, if people of color in Wisconsin had more challenges because of perhaps less robust internet connections, and if students from lower income households had more challenges. So there were a host of things that we were hoping to test for. In terms of outcomes, again, this was somewhat restricted by the relatively low response rate, but we found very few differences in the experiences of public versus private schools, the teachers or parents thereof. We did find as much in the qualitative data, because in addition to answering a number of questions that were categorical, parents and teachers had the opportunity to answer open-ended questions. And for parents of elementary age students, it did come through that they had a much more challenging experience during the pandemic than even parents of middle school and high school kids, for some of the reasons that we sort of expected, that they were less familiar with the technology, they were less able to sit for long periods of time and engage with online material. The challenges of being more isolated were perhaps heightened for those younger children. We had too few really responses from households of people of color or those with special needs kids. But again, in the open-ended comments, particularly with respect to special needs children, it came through pretty clearly that those folks had a much more difficult time during the pandemic. In terms of rural areas versus urban suburban, we didn't see very much. And I think because we asked also about what approaches they used for teaching during the pandemic. And I think in more rural areas, they adapted by using less technologically intensive forms of instruction. The use of paper assignments that the parents or the children picked up was higher in rural areas than it was in suburban or urban areas. And so we didn't really see all that much difference in terms of how well those rural areas adapted to the pandemic. Lower income households did have more technological challenges. Their internet connections were often less robust. And so the difficulty of getting on and staying on, particularly in the more technologically intensive forms of instruction, group online discussions, for example, that was a bigger problem for lower income folks. It was more of a burden on them as well, just the financial cost of the internet connection. Lack of even laptops and other things to use for the online instruction. So in terms of outcomes, about half of both the teachers and the parents were at least somewhat unsatisfied with the academic progress that their children made at all three levels, elementary, middle school, and high school. So they gave teachers a lot of credit for trying to adapt quickly to a very difficult situation. And majorities said that the approaches that teachers used were at least somewhat effective in all of the approaches that they used for the most part. So parents agreed that teachers did as good a job as they possibly could, probably, responding to this very difficult situation. And yet the progress, academic progress, was not what anybody really hoped for. In terms of specific approaches, at the elementary school level, the individual video chats were the most effective, deemed the most effective by parents, followed by recorded lectures and paper assignments. At the middle school level, the most effective were, at the elementary school, one-on-one video conferences between the teacher and the student were the most effective. For middle and high school students, the most effective were group discussions, recorded lectures, and one-on-one. So in most cases, what we found, I think, is that for elementary school students, the communication between the student and the teacher, and importantly, between students to get the socialization aspect covered was really important. And for middle and high school, it was more about engagement. So the younger students, so you can think of this about I'm an economist, so I think about supply and demand. So the supply, what the teachers were doing, can be a problem because they're not perhaps using the technology as effectively as they might. The infrastructure might not be there to support those best practices. There's a whole host of reasons why the supply problem might be dominating here. There's also demand issues from the student side. Are they able to focus long enough to get what the teachers were trying to convey? Were they simply not in doing so? And I think what happened was that there was a combination of both of those things. At the elementary school level, it was more of an issue of lack of ability to use the technology effectively because students simply didn't have the technological knowledge and didn't have the attention span to be effectively taught that way. Or at least there was a significant portion of them. At the high school level, they had the technological know-how. The teachers had a hard time getting them to engage in the material. So I think in both instances, there were issues on the supply and the demand side. Sorry, that's a long speech.
Thank you so much, David. As chair of a teacher education department and program director here on campus at a major public university, I'm always especially interested in suggestions we received regarding the preparation of future teachers to be better prepared for challenges like the COVID-19 pandemic, or even for the resurgence of this health crisis that we're now experiencing. Steve, the final report that you and David issued addresses just that question. What suggestions do you have for teacher training in the future?
Well, I think this is the key question of the future of public policy regarding colleges of education and teacher training. And David certainly mentioned it, that some technology is available, but not utilized in its full capacity, or some teachers weren't particularly trained and ready for the emergency. And a lot of the comments that we received back, especially from teachers, and I was looking at teacher responses in particular, teaching in the pre-K through 5th grade area, where I think we had more difficulty in the use of technology, that for recommendations on colleges of education in the future, and where public policy should emphasize training to prepare our teachers for emergencies such as this, that we should really focus more attention on the efficient and effective use of the technology that is out there. If you start looking at the teaching methods online, there are all kinds of options that are out there. Canvas, Google Suite, Seesaw, Google Classroom, Screen Satisfy, all kinds of systems. But teachers need to be trained in the colleges of education on how to use those more effectively. So I think for those of us, especially in early childhood, and which is Molly's specialty, we need to possibly design specific courses on the use and mastery of technology itself, So there are methods classes, substance classes, how to engage kids, but we should be thinking about classes in colleges of education that give students who are going to be teachers practical experience in both experience in front of students in a classroom setting, in addition to the use of technology in the classroom, and actually have them do practice teaching remotely more so that they are prepared for emergencies as they arise. And unfortunately, I think virtual online learning is something that we will all be engaged in more in the future. And I think a lot of schools are moving in that direction. There are some districts I've run into that have virtual academies already set up for parents who want to combine homeschooling with some schooling at within a public school setting. But we need to anticipate future online and virtual learning as something that we will face more often in the future. So I appreciate all that you have said, David and Molly, for looking at this question. This was a brief survey, and we will make available the final and complete results and post those in addition to this video to give you a URL or instructions on how to access the full-blown report, which is now available. And we'll provide that information as an attachment to this video in the future. So I think that's it. Thank you so much for your time, Molly and David. And for those of you who wish to obtain further information on this video, we will supply an additional attachment to this video on how to get the entire results that we have provided to the Thompson Center. Thanks very much to everybody, and goodbye.
Thank you.
Thank you.